I wanted to do a small review and also demonstrate this tracker, this spaced repetition study pal that I created as well, which will be available to download. Because I found some of the weaknesses with some of the testing apps out here, and I felt like, hey, you know what? I can create a Google Sheet. It's static in nature, and it's easy to download. Make it super cheap so that you have something that's kind of evergreen that you can use to study at all times. So this is the study session control panel. I'm going to select airway and breathing today. Let's do 4 questions. And when you populate 4 questions, actually, you know what? I'll just populate 3 questions just for fun. Boom. We got 3 questions. So you can type in however many questions you want. I can't remember how many airway and breathing questions I have. So let's go through here. We have our first question. What are 3 causes of inspiratory stridor? The idea is you don't really want to click reveal answer until you're ready. So you should know that answer. Like, what are the 3 causes of inspiratory stridor? Well, what is inspiratory stridor? Well, inspiratory stridor, I don't like the thickness of that pen. Inspiratory stridor has a few causes. It's a high-pitched noise, and it's generally heard it's only heard in the upper airway, and it's usually heard on inhalation. So there's 3 things about it. What are the reasons that could be causing that? Well, one would be foreign body airway obstruction. Usually these are incomplete because they're still able to move air. Think about your pediatric population, geriatric population, neuromuscular disease population that just can't move food boluses or something down their airway. So anytime you hear that, and it seems clear on the way out, that lets you know, okay, something is partially occluding the airway. So that could be one reason for it. Another reason could be some swelling. And swelling can come in the form of 2 things. Well, anaphylaxis and, see if I can get this over here. Here we go. Croup. Because croup generally has 2 issues we're dealing with. We're dealing with swelling in the upper airway. Usually we see this in pediatric patients up to the age 2 or 3, all depends on their airway. And that can have like a seal bark cough is one of the salient features of it, but also that inspiratory stridor. Now, we're really concerned when that inspiratory stridor is at rest, like when the kid's just chilling and sitting there and is calm, has inspiratory stridor, that's a problem. If they're really irritated, they're pissed off, they're, screaming and crying because they don't want you to touch them and stuff, yeah, and they have some inspiratory stridor, that's still concerning, but it's not as concerning as a chill kid who also has intercostal retractions, nasal flaring and stuff like that. So that's a cause. Anaphylaxis, yeah, we would probably see other signs too, but this is signs of airway closure. That is a major problem we have to think about. Usually it's paired with another sign, but honestly, if you have suspicion that it's anaphylaxis, they've been exposed to an allergen, either new or known, then you may want to consider epinephrine. I like to just go over, anytime you go over stuff, just make sure you have a good foundation on the treatment, the whole process, why things are happening. So you got 3 causes right there. Then you also have your other one, which would be epiglottitis. We don't see this as often anymore, but look at like 9 to 12-year-old early teen populations. But those generally also have associated with them high fevers, lots and lots of drooling, and they could also have inspiratory stridor. That's a surgical emergency. We're really just getting them to the hospital as soon as we identify them as fast as possible. This isn't somebody I would be giving epinephrine to because there's no indication for it. So you actually have, 1, 2, 3, 4 causes. Once you figure out you got all those, then you can just click reveal answer, and boom, tells you right there. Foreign body airway obstruction, anaphylaxis, croup. I didn't put epiglottitis in there, but it can happen. All right, what are the 3 upper respiratory sounds? Goodness, you should know this. So your upper respiratory noises. That's stuff that you can usually hear as soon as you come into the doorway. Upper airway sounds. That's stuff that you have to recognize quickly because that's something that will impact their airway immediately. So you should come across snoring. That's a problem. Gurgling. And of course, we already just said one, stridor. Inspiratory stridor. Snoring. How can we take care of snoring? Usually head positioning. As soon as we position their head, that ought to help get the tongue off of the posterior aspect of their pharynx. It's occluding it usually over the epiglottis. So head position, head tilt, chin lift, jaw thrust, whatever. If that doesn't solve it, you can think of NPAs, OPAs. These are pretty bad situations. Also, these are usually associated with somebody who's semi-conscious or unconscious. Gurgling, that's fluids. So we think suction. Always have your portable suction device. It would suck to get all the way down the hallway into a nursing home per se, and you come in there and the patient's like gurgling and suffocating on their own aspiration and vomit, blood, whatever it is, and you don't have your suction on you. So always have your portable suction. It's super light, super easy to maneuver. Anytime you think of like seizure activity, unresponsiveness, possible stroke, bring your portable suction with you. It only needs to happen once, and then you'll never let it happen again for you to get messed over. Especially think if you're going to like these apartment complexes that are high rises where it takes you 10 minutes just to get out to them, or cars that are in the ditch and it takes you a few minutes just to get to them. So it's too easy. It's an easy win to just have your suction devices ready. And then, of course, we just went over stridor, so that should take care of those. And then once you got those, think you know them, boom, put them there. Stridor, gurgling, snoring. All right. Then the last question, what are the 2 components of minute volume? So minute volume, this is a nice little refresher, is a function of 2 things, tidal volume and times respiratory rate. You don't necessarily need to know the math for it. You just need to know the underlying concept. Tidal volume is the amount of air that moves in and out during a inhalation exhalation phase. Exhalation phase. And respiratory rate is just, breaths per minute. That's our minute volume. What's one way to drive down our minute volume? We drive down the tidal volume. How can we do that? With shallow respirations. Shallow respirations will drive down our minute volume. That's why anytime you see the word shallow, you should automatically start thinking, oh, we probably need to bag this patient. Also, any constrictive processes like asthma, that will reduce your tidal volume. COPD, bronchitis, tension pneumothoraxes, pneumonia. All of a sudden, look how much you can get just off of knowing this one thing. My minute volume is tidal volume times respiratory rate. And anytime there is a drop in tidal volume, then there's going to be a reflexive increase in respiratory rate. Hopefully, there's a reflexive respiratory rate. So that's why you'll end up with someone who's tachypnic. They'll start recruiting additional muscles to help. That's why you end up with more accessory muscles if they have them to use. So these are all like compensatory mechanisms to compensate for that loss in tidal volume. So minute volume starts to go down, respiratory rate goes up. There's also a connection piece between minute volume and cardiac output. We actually call this relationship VQ mismatch. All right, so once you got that, reveal your answer. How accurate were you? Hey, respiratory rate and tidal volume, great. If you got those right, you just click down here, right. If you got it wrong, and then click right. I'm just doing this for giggles. As soon as you're done with this, all you have to do is click submit session here. Hopefully it works. I don't know if this button works on, it works better on the browser. And once you click that submit session here, you can actually go to your dashboard and it will align and tell you, hey, guess what? You've mastered 6% of the criteria of the content that you have, and these are the number of questions you have left to master. What I like about this study session, though, is if you get it wrong tomorrow when you do this same study session, what are the 3 upper respiratory sounds? If you didn't know that, it will populate when you click airway and breathing and you click, 5, 10 questions, whatever it is. That'll go in there. The right questions won't show up for another 2 days. That's what spaced repetition is. So it'll make sure you understand it and know it really well. It's good for practicing for National Registry, but also for any exam. Speaking of which, if you know your exam date, you can actually publish it here and just put, all right, it's going to be on 25, 20, I didn't realize I had to, 25, 20, 26. Once you click that, there it is. And good. You have this many days until your next exam or the National Registry. So good. There'll be a nice little message there. It should update, but for some reason it didn't. So that tells you, I only have 3 more days. So if you type in your date that you have either your next exam on or your National Registry on, every single day you come in to your spreadsheet, you'll be able to see how many days you have until then. And then below here, if you end up mastering some of this stuff, I just gave like cool little badges or whatever. Again, this works a little better on the desktop app than it does on the iPad app, which is what I'm using here. And this is the nuclear reset option. So let's say you went through EMT or advanced EMT school. I think this would work really well for both. And you're getting ready for registry. We'll just do a nuclear reset. It'll reset every bit of your progress, and then you can start quizzing yourself over and over and over again. This is great for like lower level thinking skills. Like this is just rote memorization. Do you know the basic information? And I found that a lot of students just don't know the basic information they need for the test in order to understand like the higher thinking stuff. So again, I think this is a solid way to study. It's a good way to review. So if you want to know more, just let me know. I should have that available pretty soon.